Wow. Nice to see everybody. Yeah, yeah, exactly.
First time since February of 2020.
So
Yeah,
it's
wow.
been a long time. Maybe it sometimes gets lonely in here. So I'll I'll get started. Good morning. We're now in the 18th month of regular press briefings, and I know when we started in March 2020, we never imagined a year and a half later we'd still be meeting regularly to talk about COVID-19. And I think today is special in that we extend a special welcome to members of the media to this briefing in person. And it is, as we just talked about, the first time really since the pandemic began. So for the last 17 months, the only other people in the room besides the Premier and Marion Dowling were the friendly camera people at the back of the room. So nice to have you back in person, and it feels different. It actually helps because I have people to look at as well. So today we'll discuss the COVID situation in PEI and Canada, and some new guidance regarding how cases and close contacts will be managed in PEI, and of course the vaccine rollout, and a little bit about what we can expect going forward. Since the weekend, there are 2 new cases of COVID-19 to report today. One individual between the ages of 10 and 19, and one in their 20s. Both cases are related to travel outside of Atlantic Canada. Contact tracing has been completed, and these individuals are self-isolating. There is one flight notification that will be, the details we're just getting, and will be released as part of the news release later. We currently have 6 active cases and have reported 214 cases since the pandemic began. In Atlantic Canada, there were 76 new cases in the last week and 101 active cases. Although the overall incidence remains low in Canada, there are early indications that COVID-19 is on the upswing in Canada. New cases were up 51% last week compared to the previous week. All provinces except Manitoba reported an increase in the number of cases. The number of COVID-related deaths in Canada also increased last week, but hospitalizations were down in the past week. Nationally, almost 90% of the cases reported since mid-December, when the vaccine became available, are individuals who are not vaccinated. And less than 1%, actually 0.5% of the cases, are people who are fully vaccinated. And the remaining 9% are partially vaccinated or not fully protected. In PEI, since January 1st of this year, 93% of our cases of COVID were people who were not vaccinated, and 1.7% are individuals who are fully vaccinated. These numbers really confirm that being fully immunized does protect people against COVID-19 and that vaccines are working. 28 of our cases have been identified as the Alpha variant, and 3 have been sequenced as the highly contagious and more virulent Delta variant. All our positive swabs do go to the National Microbiology Lab in Winnipeg for genetic sequencing to determine the strain of COVID-19, and we are awaiting sequencing results for the latest 5 positive cases. The latest national modeling suggests a potential 4th wave of COVID-19, mainly driven by the Delta variant, with a surge of cases that may start in late August, early September. Currently, 1/3 of all new cases in Canada are attributed to the Delta variant. A greater proportion of the Delta cases are partially vaccinated compared to other variants. Our best protection against the 4th wave is for as many people as possible to be fully immunized with 2 doses, and to continue to focus resources on testing, contact tracing, and case management. So all of those things together. As I mentioned publicly a few weeks ago, we need to probably have more than 80% of eligible residents fully vaccinated to protect our province, including our healthcare system, from the variants of concern and the potential 4th wave of COVID-19. The latest national modeling is that probably we need at least 83% of the eligible population to be fully immunized to protect the health system from being overwhelmed by the fourth wave. But if we continue to detect cases early and remain vigilant in contact tracing, we can protect island residents and our healthcare system from the fourth wave and avoid reimposing restrictions such as gathering limits, as long as we do all those things that we've just talked about: vaccination, early detection, and contact tracing. Since June, we've received just over 301,000 PEI Pass applications, and almost all have been processed. 48% of the applications are from people traveling within Atlantic Canada, 26% from people traveling to PEI from outside Atlantic Canada, and 24% are from PEI residents. Since June 27th, we have welcomed over 253,000 visitors to PEI. The PEI Pass verifies vaccine status prior to arriving in PEI, and those with a pass do not have to self-isolate when they arrive in the province. All individuals entering the province are screened when they enter PEI. All individuals arriving from outside Atlantic Canada are tested at point of entry, along with unvaccinated individuals from within Atlantic Canada. Thank you to our partners at Justice and Public Safety who have been working diligently to process the PEI Pass applications. And a big thank you to all the border staff and our partners for their hard work and dedication to ensure smooth traffic flow and efficient and effective screening and testing at all the points of entry. As of Saturday, August 7th, a total of 216,469 doses of vaccine have been administered. So that's 89.4% of the eligible population have received at least one dose of vaccine, and 64.6% of eligible island residents aged 12 and over have received 2 doses of vaccine. PEI continues to have one of the highest rates of first doses in Canada. We know 1 dose of vaccine provides good protection. However, 2 doses provides optimal and sustained protection against COVID-19, including the variants of concern. So those are all good, but currently we still have a large number of island residents who are not fully vaccinated. And that includes 19,000 youth under the age of 12 who are not yet eligible to be immunized. And so when you include the youth under age 12 and those who are not fully vaccinated yet in the province, we have a total of 68,000 island residents who are not fully vaccinated. While island residents have responded well to the opportunity to be immunized, we still have work to do so that we get that significant portion of the population protected. While we can be proud of our vaccine rollout strategy to date and our high rate of first doses, we need to do more to maximize the number of PEI residents who are vaccinated, especially those under age 40. We are working with various partners to further increase coverage among island residents and to reduce barriers to accessing immunization. For example, companies who have more than 5 employees who wish to be immunized can request an on-site clinic for first and second doses. Health PEI is working with both Holland College and UPI to set up vaccine clinics on campus, and we are working with community organizations to reach out to groups of people who may be hesitant to be immunized. Until more people are fully immunized, island residents are encouraged to wait 14 days after their second dose before traveling outside the province. We have been recommending an 8-week interval for most people, except for organ recipients, individuals receiving chemotherapy, or those traveling for compassionate or exceptional reasons. I'm now recommending that individuals get their second dose of vaccine 6 weeks after their first dose due to a number of factors, and just to shorten that interval a little bit. And it has to do with the increasing number of cases in the region and the country, the prediction of a fourth wave, which is likely going to happen this fall. We have good availability of vaccine in the province, and we certainly want individuals to get their second dose a little bit earlier and to be protected sooner. So our overall goal hasn't changed: to protect all eligible island residents with 2 doses of vaccine as soon as possible. Individuals who have a second dose appointment scheduled at the 8-week interval can choose to keep those appointments. Certainly I have daughters who have their second dose the end of August, I'm not planning to change that. But if they were going to be sometime in September or we had to travel, I might consider moving that a little bit earlier so that they had that before school. Anyone who wishes to move their appointment closer to the 6-week interval can do so using the online booking system. Please do not forget to cancel the original appointment. If you do not have a second dose appointment, book at one of the Health PEI clinics, either online or by calling 1-844-975-3303. Health PEI clinics are now accepting walk-ins with no appointments after 2 o'clock each day. And we remain on track to achieve our target of immunizing 80% of eligible island residents by the end of August. We know the management of COVID-19 in other provinces is starting to change, with some provinces indicating decreasing testing, isolation, and contact tracing efforts. In PEI, at this point, we will continue testing and screening at the points of entry into the fall. Contact tracing and case management will continue to be public health priorities. New guidelines for the management and control of COVID-19 in PEI are available on the provincial website. These guidelines are consistent with national direction and signal a change in how individuals diagnosed with COVID-19 and their close contacts will be managed. Specifically, the isolation requirements for positive cases and close contacts may not be 14 days in every case. People who test positive for COVID-19 will be required to self-isolate for 10 days after the onset of symptoms or from the day of their positive test, and it's 10 days provided they feel well and are not taking any immunosuppressive medications. Fully immunized close contacts who do not have any symptoms will not necessarily have to isolate. Instead, they will monitor for symptoms and we will test them regularly. Close contacts of positive cases who are not immunized or partially immunized will be required to isolate for 14 days with regular testing. It is important that close contacts who are not fully vaccinated self-isolate for that 14-day period because that is the incubation period of the virus. Casual contacts, those who might have been at the same location at the same time as a positive case with no known exposure, will usually be asked to monitor for symptoms and get tested at day 4 to 6. Public health will complete a risk assessment of each case and contact situation and make adjustments as required. Throughout the pandemic, island residents have made sacrifices to protect themselves and others. Thanks to the dedication and support of islanders, PEI has fared well throughout the past 18 months. As we look ahead to life with COVID, we're all asking that question, what will things be like? And I think we will gradually adapt to living with COVID-19 as an endemic disease, one that is regularly found in our province. SARS-CoV-2, COVID-19 will be one of many respiratory viruses that still poses a risk and needs to be dealt with. COVID-19 will not be going away anytime soon, and we will learn to live with it as productively and positively as possible. As we reconnect and begin to resume activities, some will feel quite excited and others will be more concerned. Going forward, we should plan on sticking to the public health basics. Stay home when not feeling well. Wash our hands often. Maintain as much physical distance as possible from people outside your household, wearing a mask in crowded indoor spaces, especially if you're not fully vaccinated or if you are immune compromised, and improve ventilation by opening windows and doors if possible. There is no one-size-fits-all going forward. We each have to go at our own pace, making our own decisions on what personal practices we'll follow based on several factors. Our vaccine status, being fully vaccinated lowers our risk. Our age and health, and the health of others around us. The risk of severe illness from COVID-19 increases with age and health conditions. The level of disease in the community. The more cases in the community, the higher risk of being exposed and infected. The setting and activity, where we gather, with who and what we're doing affects our risk. In terms of school reopening, it is our wish that our children return to school under as normal conditions as possible for a full year of in-class learning. Staff from our office have had preliminary discussion with officials from the education system last week to discuss the upcoming school year. And we will be issuing public health guidance later this week to assist in planning for the reopening of schools across the province, including advice for parents and guardians. We'll also be organizing what we call a tabletop planning exercise with principals, administrators, and others throughout the education system to assist in preparing for potential outbreaks of COVID-19 in schools. So we'll be doing that before school starts. As a province, the most important thing we can do to support our children, their families, and the education system is to continue to take steps to limit the importation of COVID-19 into PEI and to limit community spread of the virus when we do have cases. In conclusion, all islanders who are eligible to be immunized against COVID-19 are urged to do so. If you've not received your first dose, please make an appointment or drop into a pharmacy to discuss your options. If you're still not sure about getting vaccinated against COVID-19, please think about doing it for yourself, for your family and friends, and for our children so that they can return to school and enjoy their activities and sports and music, for our seniors so they can socialize and contribute to our communities, and for our businesses. Being fully vaccinated will minimize the impact of a fourth wave. I was watching two of my children play in a soccer game in Kensington last evening, and a gentleman who was watching his grandson play soccer came up, and he's worked different parts all over the world, and he said to me, "We are so fortunate to be living here in PEI." And I know I've said it here before, but I think his comment prompts me to say it again. There's no place I would rather be living during the midst of a global pandemic than right here in PEI. So as we continue our journey through COVID-19, and as we get closer to this finish line, let us continue to be patient and continue to be kind. Thank you. And I'll now take questions right from, yes.
Brittany Spencer, CBC.
Hello, Dr. Morrison. It's very nice to see you. So I guess my first question is about the easing around isolation requirements for positive cases as well as close contacts. You spoke a lot today about, the potential threat of a fourth wave and the Delta variant. So I guess why is now the time to ease those isolation requirements?
Well, interesting. We've been looking at some of the case management even in earlier summer, and we've learned about how the disease can transmit over the last year and a half. So there's certainly good indication now that if you're a case, by the time you're showing symptoms and test positive, you won't transmit the virus after 10 days. So that's why there's slightly shortening. It's still very important that the case isolates for the 10 days, but there hasn't been transmission after that 10-day period. So that's based on the evidence that has been collected, certainly, across the country. We still know that those who are not fully vaccinated or only partially vaccinated, the 14 days remains important because there's that incubation period that lasts longer and over that 14 days. And really, we talked about how effective the vaccines are and how many cases happen in people who are fully immunized, and the number is really small. So that's why if close contacts are fully immunized, then we'll still test them, but then they may be able to not have to undergo isolation in the same way. So it's really based on what we know and what we've learned about the disease, but also about our vaccines that we didn't have available before.
And my next question is looking at our moving forward plan, looking to September 12th, that target for step 5, which would see no limits on gatherings, no applications for domestic travel, really sort of removal of a lot of restrictions. And I'm just wondering, looking at vaccination rates, but also looking at the situation across Canada, the COVID-19 situation, how on target are we to meet sort of that goal, and what could set us back at this point?
Well, I think first part of the answer is that I think we'll actually achieve a goal of having 80% of our population vaccinated before the end of August. And so I think that is very positive. And having said that, I think that will potentially signal a loosening of other restrictions, like some of the gathering limits. But I do think that, especially in light of trying to, look ahead, and we see this fourth wave looming, and we really want to get our children back to school and in-class learning, how important that is, that we would maintain a certain degree of testing and screening at the points of entry, regardless of that level of vaccination being achieved. And that's, again, just trying to protect us as we go into the fall. So we know with that moving forward plan, the dates were always open to change, and they have been already. So, but we're trying not to look too far ahead, but hoping that we will achieve that target before the end of August for the 80%.
Thank you.
You're welcome.
Gabrielle Drummond, Radio-Canada.
Bonjour, Dr. Morrison. Alors, ma question, c'est en français. Alors, c'est par rapport à l'idée du passeport vaccinal que le Québec veut mettre en place bientôt. Puis, on sait aussi que la Nouvelle-Écosse songe aussi à mettre en place ce genre de passeport vaccinal pour les commerces non essentiels. Est-ce que ça pourrait être le cas pour nous, ici à l'île du Prince-Édouard?
Bonjour, c'est bon de te voir. Alors, je sais qu'il y a des discussions au Québec avec les passeports vaccinaux. À ce moment, on discute vraiment qu'est-ce qu'on peut faire pour augmenter le niveau de vaccination pour tous les insulaires. Alors, on ne parle pas vraiment des passeports dans ce sens. À ce moment, mais on entend les autres qui en parlent. Je pense qu'au gouvernement, au niveau national ou fédéral, il y a des discussions à propos des passeports pour le voyage hors du pays, et puis on discute ça avec, et on va participer avec ces discussions, mais on n'a pas fait une décision à propos des passeports vaccinaux ici à l'île du Prince-Édouard. Pour les activités ici. Mais je sais qu'il y a les provinces qui commencent à en parler.
Okay. Alors, ma prochaine question, vous l'avez répondu en anglais, mais j'aimerais l'entendre en français. C'est par rapport à la prochaine phase du déconfinement ici à l'île, prévue pour le 12 septembre. Donc, comme vous avez dit, on s'attend à avoir peut-être une 4e vague qui s'en vient pour le début septembre. Alors, à quoi ça va se ressembler, justement, cette prochaine phase du déconfinement ici à l'île?
En premier, on pense qu'on va avoir un niveau de vaccination que les insulaires vont avoir 80% au moins d'être vaccinés avant le fin d'août, alors c'est bon. Et puis à ce moment, on va peut-être avoir moins de mesures pour être ensemble. Alors, on peut être ensemble en plus grand nombre, comme un exemple. Mais à cause du 4e vague, à cause qu'on veut vraiment que les enfants retournent à l'école, je pense que c'est important d'avoir encore au point d'entrée, on va continuer à demander les questions avec de testing là-bas pour juste encore faire notre mieux de limiter le nombre de cas de COVID qui viennent. Parce que si on a des cas de COVID-19 qui viennent cet automne, ça va je pense, être le Delta variant. Et puis, c'est plus transmissible. Et puis, on veut minimiser l'impact de ces cas.
Merci.
Merci.
Dave Stewart, The Guardian.
Good afternoon, Dr. Morrison. It is a pleasure after all this time to finally see you in person. I guess my first question would be in regards to the Delta variant that you touched on. I know that there have been a number of news stories over the past few days, weeks, of 9 deaths attributed to COVID in youth under 12. How many cases of the Delta variant have we had in PEI, and how concerned are you of these more transmissible viruses?
Well, I think, as you mentioned, they talk about the Delta variant being more transmissible, 50 to 75% more transmissible and more virulent. We know we've had 3 confirmed cases of the Delta variant here in PEI, but we do have 5, our latest 5 cases are pending. And it certainly wouldn't surprise me if at least some of them are not the Delta variant. We know that through the year and a half, children have been less impacted in general in terms of severe outcomes, hospitalizations and deaths than older people. But this virus, I think these kinds of situations remind us that it is a virus that it changes, it develops these variants of concern. It can impact everybody. And I think that's why vaccination is really important. We know that mainly children get COVID from adults. And so how important it is as a community to try to protect our youngest children who cannot be vaccinated at this point, to do our best to protect them by being vaccinated.
Thank you. I guess my follow-up question would be, you touched on briefly that there will be some guidance coming for parents who have children in school. Can you give us a sense of some idea of what parents can expect to hear, suggestions, advice, as we go into the school year, whether the cohorting will continue as it did last year? What is the school year going to look like?
Well, I mean, I think my children are asking me the same question. But I mean, I think it will really, the guidance will be based on sort of a lower risk in the community and a situation where the risk is higher in the community. And the schools may need to adjust based on what is happening in the community. And there'll be some measures that will be really important to maintain no matter what. Don't go to school when you're sick. Washing your hands, and some of those really principles that should be there all the time. And then there'll be some other measures that may come and go depending on the situation in the community, and that would include masking, cohorting, those kind of things. So that's the kind of guidance that we're trying to put down in a short document to give to, that will be a public document. It will be to help with planning for administrators, staff, and teachers, but also to help give parents a bit of advice as they go into the school year. So we were working on it this morning, and we're hoping to get it to the education system and public schools branch by the end of the week.
Thank you very much.
Okay.
Louise Martin, CBC.
Hello, I might be the lone person on the phone here today. Thanks, Dr. Morrison, for taking our questions. I'm wondering about vaccination status. I noticed in the most recent cases, you weren't doing it on a case-to-case basis, whether the cases were vaccinated or unvaccinated. And you gave out some figures today from January. But going back to January, most of us were not vaccinated, so that kind of skews the numbers a little bit there. So is there a more recent snapshot of vaccinated versus unvaccinated being diagnosed with COVID-19 on PEI?
Hi, Louise. I know I get a chance to sometimes see you, at least on the screen, more regularly too. So when we put those numbers out today, based on our PEI numbers, they are consistent with the numbers that have just been put out nationally as well. So they did from December 14th until recently, and those were over 617,000 cases that those were based on, and only 0.5% of them were fully vaccinated who ended up having COVID. And so we did ours sort of January 1st to more recently. And obviously we've had 2 out of 117 since that time who have been vaccinated. Who have gotten 2 out of the 117 cases since January 1st. So I think it's fairly, I think that's fairly clear that there haven't been many people who have been vaccinated who have COVID.
Is there a reason we don't give it on a case-by-case basis anymore? I know Ontario, for instance, is changing the way they do it now. They're rearranging their data to present prioritize vaccinations and hospitalizations because they're obviously seeing the correlation between some vaccinated are getting sick and being able to spread COVID, but most unvaccinated are hospitalized.
Yes, and we'll probably also, I hope we don't get into that situation where we're having to indicate the percentage of people who are hospitalized, who are vaccinated and unvaccinated, but we certainly would do that. We have very low numbers, as you know, Louise, so if we announce one case and they are not vaccinated and are linked to an outbreak, I think that makes it very hard for that individual. And so we would like to do that, protect that confidentiality as much as possible. We do an age range. We've changed it so that we aren't doing male, female, for instance. We don't do county. We've adjusted so that we try to give the information, because we're giving information, because vaccination status is a population level measure, and that's why we're giving percentage of overall vaccine rate. But we know that, 1% or less than 1% nationally have been, of our cases are fully vaccinated. 1% of our cases since January have been fully vaccinated. And we may adjust, Louise, as we go on and if we get a lot more cases, but we'll continue to keep people updated in terms of the percentage or the number of cases that are fully vaccinated or unvaccinated, and then, of course, partially vaccinated, meaning 1 dose or less than 2 weeks since they had their second dose.
And so just quickly, a quick follow-up, if where we're at now in terms of moving forward vaccination status and reopening, you're satisfied with the progress and feel good about going into the fall, even though we're seeing, little outbreaks right around us in places like New Brunswick?
Well, I think we're certainly on target to achieve that 80% fully vaccinated before the end of August. But as I mentioned, last time and this time, I think it's going to be important that we achieve an even higher rate of fully vaccinated island residents. And I think if any province in this country could achieve it, it's PEI. We have, and I think to be the best protected province, we need the highest rate of fully vaccinated islanders. And I actually think we could do it here. So the highest number of fully vaccinated islanders, certainly the better, and it helps everyone. It helps those who have chosen not to be vaccinated. It helps those who are unable to be vaccinated. It helps those who are immunocompromised and can't mount the same response to vaccine. And I'm trying to remember the other part of your question, Louise. Sorry. And but in terms of being on track, I think we're certainly doing all the right things, and from a vaccine rollout point of view, and we'll continue, as we mentioned here, to try to reach people who may not have the same access or are hesitant and need certainly some explanation or some guidance.
Thank you very much.
Thanks, Louise. I think that's it. So thank you. Nice to see everybody.